Today, our guest is Dr. Rajat Chattopadhyay, MD Homeo, PhD, Principal, Calcutta Homeopathic Medical College and Hospital, Calcutta. Dr. Rajat Chattopadhyay, appointed Principal and Administrator of the Calcutta Homeopathic Medical College, the oldest homeopathic institute of Asia, established in 1881. The CMMCH was declared as the state modern homeopathic institution by Government of India. After joining to the post, Dr. Chattopadhyay took initiative to open MD course, and this year, this institute applied for PG course in practice of medicine. Dr. Rajat Chattopadhyay is the first person from regular faculty of state government who registered himself as PhD scholar at West Bengal Health University. It is expected and profession is hopeful that the post-golden period of the oldest heritage institute will again reach to the highest academic level with the joining of new principal with his able leadership and high-profile academic guidance. He's having 40 years of experience. Today, he's coping with the disease of rainy season with homeopathic approach.
So today's topic, whatever assigned to me, that is on monsoon disorders and monsoon diseases. So whatever we have last 10 to 15 years, we have observed that something changing in the environment, change in the climate, and especially after COVID-19, the COVID phase, that near about 2 years or 2.5 years. So a lot of things now in this monsoon. And previously, the monsoon means it was cough and cold. Monsoon means it was something acceleration in the rheumatism and arthritis. Monsoon means some secondary infection, like even it makes the fungal infection, the bacterial infections. These are very, very common. But now, after this COVID phase, what we have observed that the peculiarly the arthritic troubles, and specifically the autoimmunity mediated arthritis, non-specific seronegative spondyloarthritis, even ankylosing spondylosis, and seronegative spondyloarthropathies. These are the most common factors which are also this year monsoon, and we have observed in previous year's monsoon also. These are the, so our discussion, my discussion will evolve around the dermatology, around the skin infections, what we commonly face, and the arthritic troubles related the monsoon's environment, the climate, it aggravates the arthritic conditions. Definitely, it has got no relation with the emotional phase, with the factors which are underlying factors of the evolving. Obviously, climate accelerating the arthritic problem. And cold, which is very common, and nowadays it is West Bengal. I belong to West Bengal district, the West Bengal state, where 50% of if you in the road, you can see 50% with the black sunglass, dark sunglass, having conjunctivitis, and the 50% others having suffering from some other type of bacterial infection, like this type of viral or bacterial infection. So it is now very common. Fever and cough is very common. peculiarly cough. And my recent observation is that whatever medicine we are giving for these combating these fevers or cough or whatever medicine, maybe maybe antipsychotic, antisyphilitic remedy, maybe it is tubercular type, specifically Drosera, Mercurius, Marxol. These are the medicines we have to finish the treatment, or even not the finish. Two or three or four, five group of medicines. So don't ignore the running nose, which is usually of 7 days or 1 week, with medicine or without medicine. These are all self-limiting disorders. But in these post-COVID phase, during this monsoon, I am talking about this monsoon, these very benign cough and cold, ultimately very minute form of URTI, it is converting into chronic URTI like. I am not talking that it will go as LRTI or it will cause pneumonitis or it will be very severe form, but ultimately the chronicity, it is not as per its name acute or self-limiting disorders, but it is running 7 days, 10 days, the patient having fever, the fever is relapsing, the fever again coming, the cough. First of all, it was running nose, then cough usually disappear within 2 to 3 days of taking medicine, but cough is continuing, cough is continuing. Even when we are giving one good as indicated remedy as Marxol or as Drosera, as antitubercular one, or even the nosode, then only this chronicity is disappearing within 2 to 3 days. So these are the new thing what we have been observing during this monsoon in this post-COVID phase. Otherwise, it is okay. It's very common that whenever there will be drenching sweat, drenching the rainfall, and you have drenched. So obviously, Dalkamara like medicine or Rustux like medicine, and Rustux, the medicine, the position of Rustux is related to the dampness. The natrum salt, the chronicity with the dampness, but the acute phase, that is the Rustux, that is the Dalkamara, which is very much related to these monsoon, and obviously the chronic phase that may be or drenching rain, the Rustux may not be the only medicine. Dalkamara may not be the only medicine. Even Nux vomica may be useful in very many cases in running nose, in stoppage of nose, in acute to subacute allergic rhinitis. Nux vomica is another well medicine which is very much indicated with the flatulency, with the indigestion. And I must mention one drug. I must mention one drug, which is if you consult like Divi's Therapeutics or Nash Therapeutics, you can get it that the pulsatilla is the remedy. Usually, pulsatilla is known for very tough discharge, very bland discharge, very tough discharge with greenish yellowish discharge, and it is not the medicine for the acute phase, the first phase of this type of URTI or LRTI, upper respiratory tract or lower respiratory tract infection, usually in the very first phase. But it is very much indicated in acute phase also, whenever this type of cough and cold is accompanied with the gastric complaint. When gastric complaint superadded with these cough and colds, and in very acute phase, pulsatilla may be the choice of treatment. If something one or two typical characteristic of pulsatilla should present there. It is not that routine remedy, but in very many cases, pulsatilla may be indicative even in this monsoon now. So we have, I talked about the running nose, I talked about the very acute cough and colds, the allergic rhinitis, and the relapsing fever. It is my experience of West Bengal and of specific, even in Delhi, I have seen just for 2 or 3 times I have to visit Delhi. There also the relapsing fever, and the fever, it is simulating the malarial or dengue type, but it is dengue and malaria may become negative. It may not be positive, but out of 10, if the patient is relapsing, the typhoid is becoming positive. So whether these typhoid is becoming, it is false positive result, or it is the typhoid enteric fever, because typhoid also considered to be the self-limiting disorders. With the advent of these antibiotics and the modern medicine era, now the second week of typhoid, the symptoms we can't see. Usually it confined up to the first week, and it never go to the typhoid state or third week, fourth week, or the very strong complications of typhoid like intestinal complications, peritonitis, perforation, or very strong complications. These are not common nowadays. But relapsing type, within these dengue pattern or malarial pattern, ultimately the patient is diagnosed as a patient of enteric fever. So the modern medicine doctors, they are confused that whether they will be, their choice will be chloramphenicol or anti-enteric fever like, or what type. Because definitely the patient is giving you the symptoms of weakness like gelsemium. Patient is giving symptoms of weakness like sorinum. Patient is giving you symptoms like weakness of China. But whenever a modern medicine doctor will apply any medicine directly on the basis of typhoid positive and chloramphenicol type of drug or that type of drug, mostly these drugs are bone marrow depressor. So being already the patient is very weak, whenever the drug is applying, then the patient become very weak, and even the life-threatening condition may occur. So the modern medicine people also, they are in a fix that what to do right now, because most of these typhoid patient is becoming false positive. So before thinking a patient like a typhoid patient, just think of our philosophy. Consider the patient is in disease condition, whatever the symptoms the patient have. If the patient have gelsemium type of symptoms with the drowsiness, dizziness, weakness, no thirst, give gelsemium. If the disease, not only monsoon, during monsoon, just after Shravan, this Bhadro in Bengali, it's during this season, during this time, August to September, the sun is very scorching heat is there. So gelsemium, it is not only raining, and you are talking about monsoon. During the monsoon, in the interval phase, there is very strong sun heat. So that may be the indications of gelsemium. The patient exposed to that type of scorching heat within these monsoon area, but it is very, you know better. The villagers, they know better the how heat is in between interval within this period of Shravana, the last part of Shravana, or in the month of August. So gelsemium can be thought of, even antim crude may be thought of in these cases. But the most important remedy in this monsoon, in the fever, whatever I have used, that is mostly Dalkamara. And I am also myself also astonished to see that Dalkamara. I know that Dalkamara has a very good legacy, very good history with Ranjit Singh ji, with the first come in India, the very good history. But during my student life or other, we have not seen the Dalkamara in this so very strong condition. It is not in very simple situation. Even the neuritis like pain, the very chronic disease, Dalkamara may be one of the good choice. So not only in running nose, not only for a very minute form of UTI, even Dalkamara may be thought of in very serious type of complications or related to respiratory disease, related to skin disorders. These are very important part. And another drug, that is Rastux. Rastuxicodendron, definitely the same thing, Rastux with the motion aggravate, and causticum also the motion ameliorate. Sorry, Rastux in case of Rastux, motion ameliorate. First motion aggravation, continued motion amelioration in case of Rastux. But there is difference with the causticum also. Rastux and causticum, the causticum, nocturnal movement. The causticum want to move in the nights, and he moves because he gets relief. But it is purely nocturnal in comparison to Rastock. So this is a very, very small difference. Like Bryonia, the Bryonia is the same one, just opposite to Rastox. Everything like Rastox, the pain in acute rheumatism, Bryonia is also we can thought of even in monsoon area. But the effusion, the fluid, it is the difference between Bryonia and Ledumple. The effusion, the fluid, it is very, very strong in case of Bryonia in comparison to Ledumple. We know the Ledumple, the ascending type, the cold amelioration, the gouty type, nodosities, etc. But Bryonia also having all these nodosities because all the arthritic troubles aggravated during these monsoon phase, and Bryonia is one of the good remedies for gouty concretions. Gouty concretion like ammon causticum, like acid benzoic acid, very many remedies. Those remedies are always not indicated in monsoon time. But I must mention that the symptoms of hyperuricemia or hyperuricemic, not only gout, hyperuricemia patient, all those patients usually their arthritic troubles become very less in these during this monsoon season. After the monsoon is over, just after monsoon is over, all the aggravation of colchicum, aggravation of pulsatilla, aggravation of your Bryonia, aggravation of Ledumple, all these gouty patients, even of acid benzoic, covering the monsoon phase. During monsoon phase, usually these hyperuricemic remedies, indicated remedies, those are not coming in during these monsoon areas. So during monsoon, we can think of Dulcamara, we can think of Rastox, even in the acute phase Bryonia, we can think of even natrum sulf also in acute phase also, and obviously arsenic. Arsenic, the running nose, the uh, last last 7 days here in the government hospitals, more than 30 to 40 patients accidentally diagnosed as COVID positive. And all the symptoms of COVID mostly was indicating arsenic-like symptoms. So it is not that all COVID we will give arsenic. It was our choice of arsenic by the government of India. But right now the symptoms mostly of running nose, out of 10, 4 or 5, they are giving symptoms like arsenic. So if you think of arsenic, if you get the irritability, the restlessness of arsenic in the patient with the running nose, we can think of arsenic also. So apart from these respiratory part, there are few patients, the few very old patients in which you can get lot of rows, lot of crepitations, and huge during monsoon season. This become too much aggravated. So antim tart, we must think not antimars, antim tart, not ipecac, antim tart, natrum sulf, basilinum in the chronic phase as intercurrent we can think of. It is depending on indications. Whether it is written in the book that icterus of and pneumonia of right lung, antim tart, the sleepiness, the drowsiness of antim tart, because his or her respiratory system, the respiratory center is diminished, so he is in drowsy state. So in these drowsy state, if the patient's vitality is very low and the rattling of chest is much more, and you are observing that patient is going to very bad phase, you can think of antim tart with the management. Antim tart in low potency we can give in repeated dose. Higher dose is of no relief during this phase. We must think of low potency antim-arts. And Blata orientalis, previously I also say that Blata orientalis is one of the medicine I usually use it in 30 potency or in potency 6, 30 to 100. 30 is very much effective, more than mother tincture. You use Blata orientalis whenever you are thinking the patient is of arsenic but is giving no relief and having very damp aggravation with the rainy weather. The patient resides in damp areas or exposed to damp areas for 7 or 8 days and sudden respiratory distress or shortness of breath occurs. You can think of Blata orientalis. Similarly, symptoms like arsenic, but arsenic is not giving you relief, you can think of. And apart from these, another thing that is the diarrhea. During these rainy season, diarrhea is arsenic album is one of the mostly indicated in this, and pulsatilla also, not carbovates. But specifically, I have seen during this phase, if the causation is of drenching in the rain or frequent frequent rainy exposures and ultimately causing diarrhea, we can think of dalgamara, we can think of rasters. I can remember one of my mathematical teacher, he told, have you observed the color of the stool? The rustic stool color is also rusty like, or it is reddish. It is not the reddish like your bacillary dysentery or bloody dysentery. It is not like that. But the rustics, whenever the patient, he said us, you just think of rustics. The patient with the rain history of rain exposure and everything, the evolution of the disease is from the exposure to rain. And whenever if he or she develops diarrhea, then his stool will be also rustux type color. It will be reddish, very slight reddish color. It is also the indications of rustux in case of diarrhea. And if we are sure that all the causation is from drenching, is exposure to rain, then give rustux to diarrhea, to dysentery, to skin infections, to fever, whatever may be. This is the unique advantage of homeopathic system, that we have to consider the dynamic pathology, and the direct cause and effect relationship may not be established in the language of science, but you know the probability. Probability is always 50-50. So whenever we are taking the cases, the what is the exact cause, what was the cause and what was the effect, is if you have to correlate it from case taking, exhaustive case taking. A patient came to you with late night dinner, with taking a lot of alcohols, and during returning home, drenching in the rain. So what medicine you will give? For late night dinner, naxvum. For drenching in the rain, rustux. Or from taking a lot of wines and like naxvomica, so you will give naxvomica and fatty, very fatty food for pulsatilla. So whether pulsatilla, whether naxvomica, whether rustux or dalgamara, so you have to pinpoint that what was the cause. Causes are 2 or 3 probable causes, and you cannot say fix that this is the cause and so this has happened. So if after that diarrhea happened, we may think of pulsatilla or naxvomica. If after that the fever comes with that type of diarrhea, little reddish, we can think of rustux. So the symptoms will indicate that which the symptoms have the connection with the causation. These dynamic causation, cause and effect relationship, we have to bring out. This is the unique art which cannot be mechanical, which cannot be fixed, which cannot be in the computer, any software that you fit it and you get it. So it is your bonding with the patient. The patient will say that which one is more important, whether the fatty food is the most important part, or whether the alcohol was the most important part, or whether the drenching was the most important part, which caused derangement. Because 3 simultaneously not cause the derangement. Any one may be the factor. On the basis of that, any one drug we have to select. This is the uniqueness in homeopathy. So it is also very tough. It is also very tough. There is no commonness. So what usually happens, the students, the mediocre students, they cannot differentiate the remedy, and they have make a habit. You give both. Whatever may be the right, then that will be automatically selected and the other one will go. So this is not the right approach, not the right concept. Like it is very common to give Bryannia rustux, but those are the symptoms are so different. But in the student, in the very junior level, even in the senior level, I have observed that most of the doctors are prescribing both without differentiating both, because they have either they have no time, or either they don't want to take risks, because giving these Bryannia rustux 10 years, 20 years they are practicing, and till now they have not identified that what is the exact bryonia and what is the exact ras flux. But we have the differentiating features. Apart from the differentiating features, during taking the case, the patient will tell you whether he or she is bryonia or whether he or she is ras flux. This is the uniqueness. So give emphasis on our case taking during rainy season also. Rainy season, whether the rain has got impact. If the patient tells that rain has got sudden impact from the rainy season, everything I feels very better, and the rainy things, whenever there is rain, I become very romantic. I sing a song, I write the poem, and everything occurred that. So you don't forget carcinosin to that patient, and you ask, this is the 2 + 2 4 in the family history. Suddenly there is a cancer patient you will get. So this is the beauty of homeopathy, to identify the patient. First of all, whether this is rainy season or autumn or summer, that doesn't matter. But you have to identify the patient in that season. If you identify your patient with the generalities, then it will help you to prescribe the right medicine. If you prescribe pulsatilla to a Nonzumiga character patient, just due to any type of symptoms, whatever right now I told, ki gastric derangement during rainy season, give pulsatilla, but typically patient is of exact opposite character of pulsatilla. Pulsatilla will never cause anything. Only what pulsatilla can do, that is the symptoms, 1 or 2, which is very common, the pulsatilla can produce, that 1 or 2 symptoms pulsatilla can remove. That is the very short, that is not the cure. It is also written in the organon of medicine that the partial cure, most of the physicians, we are doing the partial cure. We have not the capability of making the totality in a one patient, and we have to go it through the partial cure. But it should not be. We should have very good understanding that if I am in a fix that what medicine to give, and I am giving one medicine which is not fully the simillimum in the 6 points, it is not the simillimum, then it will only disappear those symptoms which it can produce. So 2 or 3 symptoms may disappear, but the patient will not cure. These are the most important things. So whenever rainy season, we must think of septicemia. We must think of any secondary infection. In any type of secondary infection, I always give preference to arsenic group of remedies. Graphitis is very good drug for any type of eczematous eruption, but giving graphitis, prescribing graphitis during rainy season may aggravate the situation very much. So during rainy season, it is better to avoid graphitis.
I'm not living in India, but I could understand very well your point, and also very interesting talking about Dulcamara. I will look that up. And just one comment about Bryonia and Rustox. I fully agree that we should not mix the 2 remedies. Right. And they're very different. But sometimes there's a situation where they both could be useful for the patient. And that, for me, Dr. Rajat, is if the patient comes with a sciatica, pain in the back, going to the leg, down, and that's called lumbago or sciatica. And normally they don't like to move, but to lie still in bed is also not good. So what I do in that case, I give Bryonia 200, and after 4 hours, I give Rustox. After 4 hours, Bryonia. After 4 hours, Rustox. But in the first day, and then the patient will feel which remedy is a better one for him. I have to apologize to talk about this, but that's also practical in my clinic.
No. It is
sometimes they go a bit hand in hand, but never give them at the same time. Of course, you're right.
No, right. It is left-sided. Both Bryonia and Rastrix, both are left-sided. The sciatica also left-sided. So affinity is there. Yeah, you can judiciously alternate this sciatica pain during Bryonia and Rastrix, but it may not be effective to all. It may be effective to one. Yeah.
Yes, And after 1 day, they feel which one is better. So normally I do this if the symptoms are according. But very interesting your presentation, Dr. Rajat. You could go on. I would like to listen to you.
Thank you. Thank you.
One point I like to say, it is not other than, see, hydrogenoid constitution patients complaints are aggravating during this season.
Right.
That is one of the point. So we come across, see, arsenicum, causticum, dalcamra, natrum salt, Prostox, and puja. If we find out these constitutions, these are all hydrogenoid constitutions.
Right.
So we must consider this also. What?
One point I like to add over here, Madam from Germany, he told that Brownia Rastrux alteration sometimes required, and you also rightly told that two medicines together cannot be applied. I just want to mention one thing, that Hahnemann himself advocated use of Brownia and Rastrux alteration in typhus fever.
Right.
20 years ago. This is another point I'd like to add. Further one, another want to add, in monsoon, in my practice, I often use Bryonia, because in our West Bengal, monsoon is well always associated with heat.
Right.
And because of that heat and cold, Bryonia comes in very useful medicine in our acute conditions.